We have a patient today who has a reflux in her right short saphenous vein. What you're seeing on this ultrasound is her popliteal vein, which is a deep vein. Her right short saphenous vein terminates in the popliteal vein right at this little area right here. So we're going to go back a little bit. I'm going to show you what constitutes reflux. Reflux is when the one-way valves do not keep the blood from going backwards down the pipe. So what you're seeing here is I'm placing my gate on the short saphenous vein, and I'm going to augment. Augment is when we push blood through the vein, and I'm going to let go. This is reflux. So basically, as she's standing here, the vein is just refluxing and allowing the blood to come right back down. We can color code this type of thing. So I'll show you on color code. We can color code this one particular spot. And the color code, all it does is we set it up to determine color for movement. You can see these little red spots. Those are her arteries. She's really great arteries. All that means is when it's red, that flow is coming towards the probe. So on her short saphenous vein, you're going to see I'm going to push, it's going to be blue. When I let go, you see red. Red means that reflux is coming down that pipe. It gets a lot bigger here towards her calf, and it just keeps coming and keeps coming and keeps coming. The result of this is that she has a lot of leg pain, discomfort, swelling in this leg when she's standing. Today we're going to perform an Evlt on this vein. We're going to close it, and we're going to eliminate that source of reflux. Ultrasound. So our first step is a little pinch here, little local. There we go. So this is a 30G needle. We do have smaller needles, but this is pretty small. I don't think it's worse than plucking an eyebrow hair. We have our access needle, and we work with the needle bevel up. Girls make me kind of sideways here, but we'll manage to make it. So you're going to see me on the ultrasound there, and my needle is touching her short saphenous vein. When we access the vein, I can usually feel it, but there we go. A little bit more here. Just got a little. There we go. I keep thinking I'm in, but there we go. So I've got reflux in my needle. As you can see my needle in her vein, you can see those two straight lines. Then you're going to see Danielle, who's going to bring down the wire, and you'll see the wire come out of the point of the needle and call it a guide wire, and we're going to take it up the vein all the way to where we want to do a procedure. We put a little tourniquet sometimes on a short saphenous just to make sure that the vein's nice and puffy. So we're going to go up a little bit more. I'm going to take this out so far. So I'm going to put a little bit more local right here. And then we're going to do a little tiny skin nick. So just enough to allow our little catheter to get through here. Daniel wants me to hold this because she's worried it's going to pop around. So this is our laser fiber that we've measured to make sure it protrudes from the tip of the catheter. So Daniel's going to take that laser fiber out. She's going to reinsert what's known as a dilator, which is just a small little tube that goes inside the catheter and has a little point that sticks out towards the front, because that little point's going to have to burrow its way through her saphenous vein. So we're going to place that catheter over the wire. I'm going to bring it down. I'll give her a little hand here. She'll grab the wire. Patient will sometimes feel a little popping sensation here. A little bit more of a skin nick here. It's a little too conservative. Sometimes it's just a She had a little valve right there, and that's what was giving me a little bit of an issue. So we're going to take the catheter up over the vein. I'm going to take this down to a little smaller magnification because it's a little So what we're seeing here, we're seeing her short saphenous vein. That little light in there is her wire and catheter. So we're going to bring our catheter up. We're going to take a side view. You can see the wire there. You can actually see the nose of my catheter, which is coming up right about there. And we're going to take this up. We've marked where the vein goes down in the deep system. So I'm going to pull the wire back, and you'll see just the little two sides of her catheter, which are directly underneath my probe here. If we follow the short saphenous vein up, it continues into the popliteal vein here. So next step, we're going to withdraw the innards. So the innards include the wire. Daniel likes to reel that in because she's a big-time fisherwoman, I guess we'd say, sorry. Fisher person. So when she reels in the barracuda, she's going to give me the laser fiber. And what you're seeing, we're just substituting the laser fiber. A little bit of a tight little spot there. So I don't know if you noticed, but as I came down, this aiming beam appeared because the fiber has protruded out of the inside of the vein. So let's just go back and make sure we're good. So most of this procedure consists of making sure our fiber's in exactly the right place. So you'll see the fibers here, and as I go forward, that small light will disappear, which means that the fiber's gone, and that's where my laser fiber is situated. The next step, this is called endothermal ablation. There's different techniques that heat up the inside of the vein. So since it's going to heat up, if we don't numb it up or anesthetize it, it will hurt. So the next step consists of just pumping some local anesthesia around the vein. So I numbed her once. We're going to numb her 2 more times. So little tiny numbing right here on the surface of your skin. Try to trick patient's vein. You can see it just a little topple. And then I'm going to numb her up again up here, and we're going to see if that's enough. A little tiny stick, sorry. So I did make her jump. See, it's not completely painless, but as Dr. Sifu would say,
it's not painful, but it's not painless.
It's not painful, but it's not painless. So next step is to circle this vein with tumescent anesthesia. So what we're doing is we're just eliminating the bubbles in the tubular, in the tubing. And then when we have that, we will be able to, okay? So what you're going to see me do here is just come over next to the vein. Vein's in a little sleeve there. Sometimes patients feel this little tiny sleeve can be tender if their vein's been dilated. And we're just pumping water around the vein. I don't know if you see that black image there. Her vein is directly in the center there, towards 12 o'clock there. So there are procedures where we do not have to numb the vein up. They have different techniques of closing the vein. And we've been utilizing those also. For the moment, they're fairly new, and insurance reimbursement is a little difficult to obtain. So I'm going to go up a little bit higher here. You see me. I'm trying to get all this by just 2 skin. I may need to numb a 3rd time. Sometimes I'm a little over-optimistic. So again, you'll see me, her vein is right there, right next to it. You want to be careful not to damage the, that hurts a little bit, sorry. Excuse me, I'll slow down a little bit. Excuse me. Sometimes what patients feel is that stretching on that little, call it the saphenous compartment there, these little fascias that are around the vein. So if I slow down, it gives enough time for the local to numb things up. Is that better? Okay.
Somebody's knocking. Come on in.
We do not have ghosts in this office, so if someone's knocking on the door, there's probably somebody there.
I think it's the doctor.
I may need to.
Yes. Can you get us glasses?
Yeah.
Perfect.
So we've numbed everything up. So our next step is actually going to be to do her procedure. Okay. We have normally adequately numbed everything up. And our next step will be to actually do our procedure. So I'm going to make a little ruler on her leg, a little marker, skin marker here, because the purpose of this is to apply a certain amount of heat along the vein. Okay, so we're going to all put on some glasses to protect our eyes in case we were to inadvertently shine the laser in our eyes. Lasers can also reflect off of surfaces such as windows, clocks, so you have to be careful to respect laser safety procedures. Okay, so we're going to start by making sure everything's nice and numb.
Laser enabled and what's continuing.
Then just turn on the laser. We can use different energy settings on the laser. We usually use 10 watts. So what you'll see, the laser is right there. I'm going to do a little test. So we're going to test and make sure you're numb, okay? So if I use the right pedal, it helps. So I don't know if you noticed, but right away we saw, that hurt? No.
¿Te duele?
Okay. She's just a little uncomfortable on the table. Okay, so we're going to do a procedure here. So basically what we're doing is just bringing this laser fiber back down. Check and make sure eyes look. That the laser fiber is not firing off to the side, that it hasn't been damaged or something during previous manipulation.
3.
So as you see here, I'm just bringing the laser down about 1 centimeter per second.
4.
So that's 100 joules. Then I'm going to speed up a little bit because the vein will get a little bit smaller in diameter and typically require a little less
5.
energy. So always try to get the top initial part closed as well as possible. You can see
6.
where I'm at on the screen, and I'll show you a side view here. So you'll see the laser. It looks like a little firecracker here. There you go. See me pulling it. So the laser, the tip of the laser is right in the middle of the screen there.
8.
And you can see above it, there's a lot of water that I pumped around the vein. So what's nice about this technique is that the recurrence rate is extremely low, 0.4%. We've seen less than that compared to surgery, which has a very high recurrence rate. So as we get down towards the bottom here, I'm going to speed up because sometimes there's some little nerves here. And basically we've finished our procedure. So we check the laser fiber to make sure it didn't break, make sure everything looks good, and the procedure is done.